Genius Solutions: How to Meet EHR Meaningful Use Incentive Using Modified Stage 2 Objectives from 2015 through 2017.
It is important to note that there have been some changes to the Meaningful Use Incentive Program. As of October 6, 2015, CMS has published a final rule that changed the requirements for meaningful use for all stages. All providers must meet the modified Stage 2 objectives. CMS has eliminated several objectives and narrowed down the objectives to 10. Since some providers were scheduled to perform Stage 1 objectives, there are alternative measures and/or exclusions for those providers. And clinical quality measures must be reported electronically.
This webinar will go over the following topics: important dates and deadlines for meaningful use, reporting period information, measure objectives, descriptions, thresholds, and exclusions, measure demonstrations within ehrTHOMAS, clinical quality measures, attestation and audits, and helpful resources. Important dates. December 31st, 2015 is the end of the 2015 reporting period. January 1st, 2016 is the start of the 2016 reporting period. January 1st through February 29th is the 2016 Hardship Reconsiderations Application Submission period. January 4th through February 29th, EPs can submit their attestation for the 2015 reporting period. And December 31st, 2016 is the end of the 2016 reporting period for EPs. For 2015 only, all providers, regardless of stage, can report meaningful use for any continuous 90-day period within the calendar year. Additionally, providers can report clinical quality measures for any 90-day period for 2015. However, if the office is associated with other incentive programs, such as PQRS, they must report a full year of data. Starting 2016 and beyond, new participants to the EHR incentive program can report for any continuous 90-day period within that calendar year. Those EPs who have already participated in the EHR incentive program will have to report for a full year, and CQM data must be reported for a full year. All EPs must meet the following objectives for meaningful use. We will be touching base on every single one of these objectives, their thresholds, the exclusions, and how to reach each measure using ehrTHOMAS.
Protect electronic health information. Objective: protect electronic health information created or maintained by the certified EHR technology through the implementation of appropriate technical capabilities. Measure for 2015 through 2017. Conduct or review a security risk analysis in accordance with the requirements under 45 CFR 164.308, Parent A, Parent 1, including addressing the encryption security of data stored in certified EHR technology in accordance with requirements under 45 CFR 164.312, Parent A, Parent 2, Parent 4, and 45 CFR 164.306, Parent D, Parent 3, and implement security updates as necessary and correct identified security deficiencies as part of the provider's risk management process for EPs. Exclusion: no exclusion or Stage 1 exclusion. Protect electronic health information. In addition to meeting each measure of meaningful use, CMS requires eligible professionals to conduct a security risk analysis. If the office has their own hardware technician, please contact them regarding a security risk analysis. Please refer to the Security Risk Analysis tip sheet on the CMS website regarding more detailed information about this measure.
Clinical decision support. Objective: use clinical decision support to improve performance on high-priority health conditions. There are two measures to meet this objective. Measure 1, for 2015 through 2017. Implement 5 clinical decision support interventions related to 4 or more clinical quality measures at a relevant point in a patient's care for the entire EHR reporting period. Absent 4 clinical quality measures related to an EP's scope of practice or patient population, the clinical decision support interventions must be related to a high-priority health condition. Exclusion: there are no exclusions or Stage 1 exclusion for this particular measure. Measure 2. For 2015 through 2017, the EP has enabled and implemented the functionality for drug-to-drug and drug allergy interaction checks for the entire EHR reporting period. Exclusion. Any EP who writes fewer than 100 medication orders during the EHR reporting period. If you are scheduled to be in Stage 1 for 2015, there is an alternate objective and measure. Objective. Implement one clinical decision support rule relevant to specialty or high clinical priority, along with the ability to track compliance with that rule. Measure. Implement one clinical decision support rule. Clinical Decision Support Rules, or CDS rules. There are two components to complete this measure: implementing 5 CDS rules and enabling drug-to-drug and drug-to-allergy interaction checks. To see if CDS rules were implemented, click on Code Files, then CDS Rules. This screen will show all CDS rules that have been implemented in your EHR. To add a new CDS rule, click on Add. For this demonstration, we will be using PQRS measure 163 Diabetes Foot Exam. This measure asks for the percentage of patients aged 18 through 75 years of age with diabetes who had a foot exam during the measurement period. We will enter the name of the rule at the top, and then enter the rule source. This is the reference of where the rule came from. We will now attach conditions in order to make this rule populate. Let's first define the patient's age. Click on Add Group. To indicate that we want this rule to show up for patients over the age of 18, we will select from this drop-down, Patient Age, indicate greater than, and then the age of 18. Since we do not want to add this rule to patients over the age of 75, we need to limit our rule. To do this, click on Add Group again. We'll select patient's age, in this drop-down, less than, and then the age of 75. This CDS rule will be applied to patients who are older than 18 and less than 75 years of age. Now that we've defined the age range, we need to find patients who has an active condition of diabetes. We will click on Add Group, and then from this drop-down, select Conditions. Click on the magnifying glass to search for a condition. We will search for diabetes at the bottom right corner here, and then select our code. Click on the code, and then click on Select. In this next drop-down, click on Active. This group is selecting patients that currently have 250.00 as an active diagnosis. Click on Add Item button on this side here to add an additional condition. Again, we will have to select Condition and then search for a diabetes code. Select your code, then click on Select. If your office has more than one diabetes code, you will have to repeat this step until all your codes are entered into this rule. This rule is now filtering our patient list by patients older than 18, less than 75, and patients who have the code 250.00 or 250.01. Click Save to save this report. If you require additional assistance, please contact Genius Solutions EHR support. If the patient falls under the criteria of a CDS rule, you will notice that there is one active alert on this patient. By clicking on the alert, it will tell you how this patient falls under the criteria. This patient's age is greater than 18, is also less than 75, and has a condition of 250.00. Once you perform the foot exam, you can go ahead and click on Complete. CPOE for medication, laboratory, and radiology orders. Objective: use computerized provider order entry, or CPOE, for medication, laboratory, and radiology orders directly entered by any licensed healthcare professional who can enter orders into this medical record per state, local, and professional guidelines. There are 3 measures to meet this objective. Measure 1. For 2015 through 2017, more than 60% of medication orders created by the EP during the EHR reporting period are recorded using computerized provider order entry. Exclusion: any EP who writes fewer than 100 medication orders during the EHR reporting period. Measure 2. For 2015 through 2017, more than 30% of laboratory orders created by the EP during the EHR reporting period are recorded using computerized provider order entry. Exclusion: any EP who writes fewer than 100 laboratory orders during the EHR reporting period. Measure 3. For 2015 through 2017, more than 30% of radiology orders created by the EP during the EHR reporting period are recorded using computerized provider order entry. Exclusion: any EP who writes fewer than 100 radiology orders during the EHR reporting period. If you are scheduled to be in Stage 1 for 2015, you may choose an alternate measure for Measure 1. Alternate Measure 1. More than 30% of all unique patients with at least one medication in their medication list seen by the EP during the EHR reporting period have at least one medication order entered using CPOE. Exclusion: any EP who writes fewer than 100 medication orders during the EHR reporting period. If you are scheduled to be in Stage 1 for 2015 and or 2016, you may claim an alternate exclusion for Measure 2, laboratory orders, and Measure 3, radiology orders, for the 2015 and 2016 reporting period.
To use CPOE for medication orders, in an open encounter, click on the Medications module. Then click on Doctor First. You will be redirected to the Doctor First web page. If this is the first time you are e-prescribing for a particular patient, you will be prompted to enter in allergy information and pharmacy information. Once you have completed this, click on the Prescribe tab. Type in the appropriate prescription name and click Find. Remember to select the prescription from the generated list. Do not free text the entire name of the prescription. Enter in the appropriate details if they are not already filled out. Scroll down and click Continue. You will be prompted of any alerts, if there are any, regarding this prescription. If you wish to make any changes or adjustments, click on the Back button. If not, click on Prescribe anyway. The next screen will allow you to review the details of the prescription. If everything looks okay, click on OK. If there are any coupons for the prescription, they will generate at the next screen. You may print this out for the patient. Scroll down and select the prescription you wish to prescribe. Type in the provider's signature password, and you may either select Send, Send and Print, Print without sending, or Sign without sending. You have now e-prescribed the medication for your patient. Click Return to EMR when complete. There are two ways to use CPOE for laboratory orders: by manually ordering a lab or by importing lab results from a lab interface. To manually order a lab, in an open encounter, click on the Labs module. Then click on the Add button. Select the appropriate location from where the lab will be ordered from the drop-down menu, and fill out additional miscellaneous information such as the ordering physician and the date for which to order the labs. Click Accept. Then click on the appropriate lab to be ordered and click Next. Scroll down to find the most recent lab you just ordered to confirm. Then click Close. To import results from a lab interface, click on the Labs button. Select the appropriate provider from the drop-down menu. The name of the patient should appear next to Patient or to the area to the right. I will be manually typing in the name of the patient for demonstration purposes. To select a location, click on the magnifying glass next to Lab, and then select the appropriate lab. Select an encounter for which to attach the lab results, or click the Add button to add a new encounter. Then click on the Import button next to the name. Click on the Recent tab to sign off on the lab results. If you are unable to sign off on the lab results, that means there are more lab results waiting to be imported for this particular patient. To use CPOE for radiology orders, in an open encounter, click on Diagnostic Orders. Click on the Add button to add a new diagnostic order. Select the appropriate facility from which to order the diagnostic test from, and then select the appropriate diagnostic test or order. You may fill out the miscellaneous information if desired, and then click Next. If everything is correct on your screen, click the Save button. The next screen to generate will be the prescription screen for the diagnostic order. Print out the prescription screen and have the provider sign the prescription and hand it to the patient. You have now just created a diagnostic order. E-prescribing, or ERX. Objective: generate and transmit permissible prescriptions electronically via ERX. Measure for 2015 through 2017. More than 50% of permissible prescriptions written by the EP are queried for a drug formulary and transmitted electronically using certified EHR technology. Exclusion: any EP who writes fewer than 100 permissible prescriptions during the EHR reporting period, or does not have a pharmacy within his or her organization, and there are no pharmacies that accept electronic prescriptions within 10 miles of the EP's practice location at the start of his or her EHR reporting period.
If you are scheduled to be in Stage 1 for 2015, there is an alternate measure for this particular objective. Measure: more than 40% of all permissible prescriptions written by the EP are transmitted electronically using the CEHRT.
This measure is met in the same way as CPOE for medication orders. In an open encounter, click on the Medications module. Then click on the Doctor First button. You will be redirected to the Doctor First webpage. If this is the first time you are e-prescribing for a particular patient, you will be prompted to enter in any allergy and pharmacy information. Once you have completed this information, click on the Prescribe tab. Type in the appropriate prescription name and click Find. Remember to select the prescription from the generated list. Do not free text the entire name of the prescription. Click on the desired prescription and fill in any desired details if necessary, and click on Continue. You will be prompted of any alerts regarding the prescription. If you wish to make changes to the prescription, click on Back. If not, click on Prescribe anyway. The next screen will allow you to review the details of the prescription. If everything looks okay, click on OK. If there are any coupons for the prescription, they will generate on the next screen. You may print this out for the patient. Scroll down and select the desired prescription you are prescribing and type in the signature password. From here, you may click Send, Send and Print, Print without sending, or Sign without sending. You have just e-prescribed a medication. Health Information Exchange. Objective: the EP who transitions their patient to another setting of care or provider of care or refers their patient to another provider of care should provide summary of care record for each transition of care or referral. Measure for 2015 through 2017. The EP that transitions or refers their patient to another setting of care or provider of care must 1. Use certified EHR technology to create a summary of care record, and 2. Electronically transmit such summary to a receiving provider for more than 10% of transitions of care and referrals. Exclusion: Any EP who transfers a patient to another setting or refers a patient to another provider less than 100 times during the EHR reporting period. If you were scheduled to be in Stage 1 for 2015, there is an alternate exclusion. Providers may claim an exclusion for Part 2 of this measure that requires the electronic submission of a summary of care document, since there was no equivalent measure in Stage 1.
1. Provide a summary of care record for patient who transitions out of the office. There are 2 steps to meet this measure. Indicate that the patient has transitioned out of the office, then provide that patient with a clinical summary. To indicate that the patient has transitioned out of the office, click the Change Encounter Header Information button. Select the appropriate transition status from the drop-down menu. Then check the Transitioned Out checkbox. Then click on Save. A clinical summary now must be created. Click Create CCDA, and then select either Create CCDA or Print CCDA. Once a CCDA has been created, a screen will appear to indicate so. Clicking on Open will allow you to open the location of the CCDA file, and clicking on View will allow you to review that CCDA. Click OK. 2. Of the patients that have been transitioned out of the office, a summary of care must be sent to the provider you are transitioning the patient to through ehrTHOMAS or through a health information exchange program. ehrTHOMAS can send direct messages to other providers as long as the other provider's EHR is associated with the blue button plus community group. Your office will need to obtain the provider's direct address. Once you have that direct address, you must record that information inside of ehrTHOMAS. To do this, click on Code Files, then select Referrals. Select the appropriate provider, and then click on Edit. Enter in the provider's direct address here into the direct address input area. Then click on Save. To send a direct message to a provider that's associated with blue button plus community group, click on the Messages button. Then select the Direct Message tab. If you do not see this tab, please call Genius Solutions EHR Support. Click on Add to add a new message. Fill out the new direct message window. Select your provider, who you are sending this message to, the patient's name, which encounter you want to select, and then type in your subject, and then enter in your message. Attach the patient's CCDA by clicking on Attach. Locate the location of the file, and then open that file. You will notice that the CCDA is now attached to this message. Click on Send to send out the message. If the provider you want to send a CCDA to is not associated with the blue button plus community group, you must indicate that the CCDA was sent through an HIE after the creation of the CCDA by clicking the Send to HIE checkbox. Indicate which provider you are sending the CCDA to, and then click on Select. You must also enter the date you are sending the CCDA. It is important that you send the CCDA on the date declared. Once you have indicated in your EHR that you are sending the CCDA through an HIE, you must go through your HIE and send the message to that provider. For additional help regarding this measure, please call Genius Solutions EHR Support.
Patient-specific education. Objective: use certified EHR technology to identify patient-specific education resources and provide those resources to the patient if appropriate. Measure for 2015 through 2017. Patient-specific education resources identified by certified EHR technology are provided to patients for more than 10% of all unique patients with office visits seen by the EP during the EHR reporting period. Exclusion: any EP who has no office visits during the EHR reporting period. If you were scheduled to be in Stage 1 for 2015, there is an alternate exclusion. Providers may claim an exclusion for this measure if they did not intend to select patient-specific education as a menu objective for the Stage 1 2015 reporting period. There are 3 ways to meet this measure: by printing out preloaded educational documents, indicating that verbal education was provided, and/or clicking the Medline Plus icon. To print out educational documents, click on the Education module. Click on the appropriate preloaded document, and then click Next. Select Open File to print out the document and hand it to the patient, followed by Complete when you're done. Click Save to save your results. To indicate that verbal education was provided, again, click the Education module and select Add Free Text Education. Type in your caption and the type of verbal education that was provided, and click Save. Click Next, followed by Complete, and then Save to save your results. To use the Medline Plus icon, you can find it in the Medications module and the Condition Tracking module. You will find the icon next to the prescribed medication and next to the diagnosed condition. Clicking the Medline Plus icon will redirect you to a web page containing information on the diagnosis or medications related to the particular patient. For example, clicking in the Medications icon, followed by the Get Medline Plus Connection Info, redirects you to the following website. Here you will find the information on the medication or diagnosis related to the particular patient. You may print out the document and hand it to the patient. Medication reconciliation. Objective. The EP who receives the patient from another setting of care or provider of care or believes an encounter is relevant should perform medication reconciliation. Measure 2015 through 2017. The EP who performs medication reconciliation for more than 50% of transitions of care in which the patient is transitioned into the care of the EP. Exclusion. An EP who was not the recipient of any transitions of care during the EHR reporting period. If you were scheduled to be in Stage 1 for 2015, there is an alternate exclusion. Providers may claim an exclusion for this measure if they did not intend to select medication reconciliation as a menu objective for the Stage 1 2015 reporting period. This must be done for every patient that is transferred into the office. There are 2 steps in meeting this measure: indicating that the patient is a transition into the office and filling out the medication module. To indicate that the patient is a transition into the office, create or open a new encounter. If the current encounter screen does not appear, you may click the Change Encounter Header Info button. Change the transition status appropriately from the drop-down menu, and make sure the Transition Out box is not checked off. Click Save to save your results. Now you must perform medication reconciliation for the patient. This must be done through the Medications module by following the same steps in the CPOE and E-prescribing measures. Patient Electronic Access, or VDT. Objective. Provide patients the ability to view online, download, and transmit their health information within 4 business days of the information being available to the EP. There are 2 measures to meet for this objective. Measure 1 for 2015 to 2017. More than 50% of all unique patients seen by the EP during the EHR reporting period are provided timely access to view online, download, and transmit to a third party their health information, subject to the EP's discretion to withhold certain information. Measure 2 for 2015 and 2016. At least 1 patient seen by the EP during the EHR reporting period, or patient authorized representative, views, downloads, or transmits to a third party his or her health information during the EHR reporting period. Measure 2 for 2017. More than 5% seen by the EP during the EHR reporting period, or patient authorized representatives, views, downloads, or transmit to a third party their health information during the EHR reporting period. Exclusion for both measures. Any EP who, neither orders nor creates any of the information listed for inclusion as part of the measures, or conducts 50% or more of his or her patient encounters in a county that does not have 50% or more of its housing units with 4 megabits per second broadband availability, according to the latest information available from the FCC on the first day of the EHR reporting period.
There are two components to this measure: providing the patient with the ability to view, download, or transmit their health information online, and have the patient view, download, or transmit their health information. To provide the patient with the ability to view, download, or transmit their health information online, in an open encounter, click on the patient's name or the patient picture to open the patient edit screen. Scroll down to the bottom and select the Microsoft Health Vault dropdown. Click on Connect to Health Vault. Here, make sure that you put in a security question and then the answer to the security question. Make sure that the patient knows what the security answer is, as it's required for registration. If a patient's email address has not been entered, go ahead and enter that information here. Then click on the Send button. From this screen, print out the instructions on how to set up their Health Vault account. The patient will also get a link sent to their email with further instructions. Once the invitation to register for Health Vault has been sent, some information will show up. This code is a security feature for Health Vault. It will expire after 2 weeks of first generating the code. To check if the patient has created a Health Vault account that is associated with your office, click on the Check for Completed. If the patient has not completed the registration process, the screen will not change. It is important that the user reissues the Health Vault access at every visit if the patient has not completed their registration. If the patient has completed the registration, information will disappear. Now, when you create a CCDA, you have the ability to send a Health Vault. You must send the CCDA to Health Vault if the Health Vault registration has been completed. Click Send to Health Vault, and the next window will indicate that the CCDA has been created and sent to Health Vault. Click Yes to review the CCDA, or click No to exit out of the screen. The second component of this objective is having the patients review, download, or transmit their health information online. It is best practice to walk through the registration process with the patient to ensure they have registered and reviewed their health information. To view which patient has viewed, downloaded, or transmitted their health information, go to Reports, then click on VDT Report. Enter in the start date and the end date. The list will automatically generate. In case of an audit, click Print Report. Save this report for your records. For additional help setting up a Health Vault account, please contact Genius Solutions EHR support.
Secure electronic messaging. Use secure electronic messaging to communicate with patients on relevant health information. Measure for 2015. The capability for patients to send and receive a secure electronic message with the EP was fully enabled during the EHR reporting period. Measure for 2016. For at least one patient seen by the EP during the EHR reporting period, a secure message was sent using the electronic messaging function of the certified EHR technology to the patient, or the patient authorized representative, or in response to a secure message sent by the patient or the patient authorized representative during the EHR reporting period. Measure for 2017. For at least 5% of unique patients seen by the EP during the EHR reporting period, a secure message was sent using the electronic messaging function of certified EHR technology to the patient or the patient authorized representative, or in response to a secure message sent by the patient or the patient authorized representative during the EHR reporting period. Exclusion. Any EP who has no office visits during the EHR reporting period, or any EP who conducts 50% or more of his or her patient encounters in a county that does not have 50% or more of its housing units with 4 megabits per second broadband availability, according to the latest information available from the FCC on the first day of the EHR reporting period. If you were scheduled to be in Stage 1 for 2015, there's an alternate exclusion. Providers may claim an exclusion for the measure since there was no equivalent measure in Stage 1.
It is best practice for the office to walk the patient through how to send a direct message. Make sure that you have the provider's direct address on hand. To locate the provider's direct address, click on Code Files, then Providers. Select the appropriate provider, and then click on Edit. The provider's direct address is located in the direct address input area. On the Patient's Health Vault homepage, scroll down and click on Health Message. To send a new message, click on New. Type in the provider's direct address, a subject, and a message. To send the message, click on Send. To review the message inside of ehrTHOMAS, click on Messages, then select Direct Messages. Select the appropriate provider, and ensure that the Show drop-down shows Received. Your message will appear here. Click on the message, and click on View to review that message. To send a message back to the patient, click on Reply. To send a secure message to a patient, click on Add. Select the appropriate provider from the From, and then start typing in the patient's name. Type in a subject and a message, and then click on Send.
Alternate exclusions for Stage 1 providers in 2015. You may claim an alternate exclusion for Measure 1, Measure 2, or Measure 3. May be claimed up to 2 measures. Then the provider must either attest to or meet exclusion requirements for the remaining measure. Alternate exclusions for Stage 2 providers for 2015. May claim an alternate exclusion for Measure 2 or Measure 3, which is syndromic surveillance measure or specialized registry reporting measure. Measure Option 1, Immunization Registry Reporting. The EP is an active engagement with a public health agency to submit immunization data. Exclusions. Any EP meeting one or more of the following criteria may be excluded from the Immunization Registry Reporting measure if the EP does not administer any immunization to any of the populations for which data is collected by its jurisdiction's immunization registry or immunization information system during the EHR reporting period, operates in a jurisdiction for which no immunization registry or immunization information systems is capable of accepting the specific standards required to meet the certified EHR technology definition at the start of the EHR reporting period, or operates in a jurisdiction where no immunization registry or immunization information system has declared readiness to receive immunization data from the EP at the start of the EHR reporting period. Measure Option 2, Syndromic Surveillance Reporting. The EP is an active engagement with a public health agency to submit syndromic surveillance data. Exclusions. Any EP meeting one or more of the following criteria may be excluded from the syndromic surveillance reporting measure if the EP is not in a category of providers from which ambulatory syndromic surveillance data is collected by their jurisdiction's syndromic surveillance system, operates in a jurisdiction for which no public health agency is capable of receiving electronic syndromic surveillance data from the EPs in the specific standards required to meet the certified EHR technology definition at the start of the EHR reporting period, or operates in a jurisdiction where no public health agency has declared readiness to receive syndromic surveillance data from the EP at the start of the EHR reporting period. Measure Option 3, Specialized Registry Reporting. The EP is an active engagement to submit data to a specialized registry. Exclusions. Any EP meeting one or more of the following criteria may be excluded from the specialized registry reporting measure if the EP does not diagnose or treat any disease or condition associated with or collect relevant data that is collected by a specialized registry in their jurisdiction during the EHR reporting period, operates in a jurisdiction for which no specialized registry is capable of receiving electronic registry transactions in the specific standards required to meet the certified EHR technology definition at the start of the EHR reporting period, or operates in a jurisdiction where no specialized registry for which the EP is eligible has declared readiness to receive electronic registry transactions at the beginning of the EHR reporting period. Immunization Registries Data Submission. ehrTHOMAS has the ability to export HL7 files for immunizations in the states of Michigan and Florida. If your practice performs any immunizations, the setup to send electronic data has already been completed. There are two ways to send electronic data to immunization registries: by individual vaccinations or by batch. To send HL7 files by individual vaccinations, in an open encounter, click on the Immunizations module. Then click on the drop-down arrow next to a performed vaccination on the left side of the screen under Vaccination Received. Click Create HL7. To send HL7 files by batch, click on the Reports button, and then click on Immunization. Complete the appropriate fields, and then click the Export button. Syndromic Surveillance Data Submission. If you will be using this function, begin by clicking on the Code Files button. Select System Settings, and in the search box type in MS. You must activate and enter the appropriate information for the last 4 settings. If you need assistance with these settings, please call ehrTHOMAS support for more assistance. Once you've activated the appropriate settings, click on the Save button. To produce the Syndromic Surveillance Report, click on Reports, followed by Syndromic Surveillance. Select the appropriate timeline and the appropriate doctor, and then click the Export button.
For specialized registries, please contact your registry to see if they can be used for meaningful use.
Clinical quality measures. EPs still need to report clinical quality measures electronically. Options that apply only for the EHR incentive program. Option 1. Attest to CQMs through the EHR registration and attestation system. Option 2. E-report CQMs through Physician Quality Reporting System or PQRS portal. Please note that meaningful use CQMs and PQRS are 2 separate incentive programs. You must report on 9 total measures from 3 different domains. The domains are as follows. 1. Patient and family engagement. 2. Patient safety. 3. Care coordination. 4. Population and public health. 5. Efficient use of healthcare resources. 6. Clinical processes and effectiveness. ehrTHOMAS is certified for the following measures: CMS 69, preventive care and screening, body mass index screening and follow-up; CMS 117, childhood immunization status; CMS 122, percentage of patients 18 to 75 years of age with diabetes, type 1 or type 2, who had hemoglobin A1C greater than 9%. CMS 123, the percentage of patients ages 18 to 75 years with diabetes, type 1 or type 2, who had a foot exam, visually inspection, sensory exam with monofilament or pulse exam. CMS 125, breast cancer screening. CMS 127, pneumonia vaccination status for older adults. CMS 130, colorectal cancer screening. CMS 138, preventive care and screening measure. A, tobacco use assessment, and B, tobacco cessation. CMS 139, Screening for Future Fall Risk, CMS 147, Preventative Care and Screening, Influenza Immunization for Patients 6 months old and older, CMS 155, Weight Assessment and Counseling for Children and Adolescents, CMS 156, Use of High-Risk Medications in the Elderly, CMS 163, Percentage of patients 18 to 75 years of age with diabetes type 1 or type 2 who had LDL cholesterol less than 100 milligrams per deciliter, CMS 165, Controlling High Blood Pressure, and CMS 182, Ischemic Vascular Disease, Complete Lipid Panel and LDL Control. It is strongly recommended that providers select CQMs that are relevant to their patient population. Genius Solutions will not pick CQMs for you. Reporting zeros is acceptable for meeting the CQM's meaningful use objective for the reporting period. If the provider is applying for PQRS, it is extremely important that the office select measures that are relevant to the practice and performance rates are not 0%. If the office cannot select 9 measures across 3 domains within ehrTHOMAS, PQRS measures must be reported elsewhere. To meet PQRS, the provider must submit data through the PQRS portal, not just through the Meaningful Use Attestation website. For more information on how to meet each CQM in ehrTHOMAS, please review our Clinical Quality Measure document. Attestation and audits. Make sure you are registered with CMS and with the state for Medicaid. Please make your providers have a username and password to access the attestation website. ehrTHOMAS is certified for Meaningful Use 2014. You must attest with the modified Stage 2 measurements. You must report numbers that are over the threshold. If the threshold states more than 50%, you must have 51% or higher. You must provide data for all measures. During the attestation, if you are excluded from more than 5, you must indicate that you are excluded from those measures. CMS will ask for the ehrTHOMAS certification number. The certification is as follows: A014E1 O5 FACEAN. In case of an audit, please have the following: proof of purchase of ehrTHOMAS, proof of a security risk analysis, documentation on all measurement exclusions. For example, if you have less than 100 meds, labs, and radiology orders, your meaningful use report should reflect that, and documentation of public health exclusions. Documentation referencing all CDS rules used, and copy of your meaningful use report for the appropriate reporting period, and a copy of any documents regarding registry measures. This concludes our Modified Stage 2 webinar. For more information regarding Stage 2, please visit the following websites. If you have any questions on how to meet Modified Stage 2 measurements, please do not hesitate to give our office a call. Thank you for watching.